Hey y'all, my name is Joshua Crift. I'm currently here a nursing student at Western Iowa Tech, and I'm from Atlanta, Georgia. So, nursing has been, to me, a very underappreciated field for a very long time. Um, Nurses are the workhorses behind doctors' orders and any other health provider's orders. Like, we actually take the orders out and make sure it's given correctly and make sure it's done correctly. So, I know my first nursing semester this year, um, we've learned a whole bunch of medications. Like I never knew that there were this many medications out there in the world, but there are so many medications. There are medications for everything. And nurses really have to know what are the specific amounts that a patient is supposed to get, what's therapeutic and what can actually hurt a patient. So when a doctor gives an order, if he makes a mistake, we have to be the ones that can check it and be like, hey, this is wrong, let's get this right so we can make sure our patient is doing okay. Um, we have to learn about all the systems, like from gastrointestinal to the respiratory system to the cardiovascular system and even the neural system. And I know next semester we'll be getting more into like the OBGYN type stuff and pediatrics, so learning about kids. Right now we're on geriatrics, but nurses are so instrumental, and I'm so glad that I decided to learn how to become one, because without nurses we wouldn't have anything. Like the doctor might see a client for 5 minutes, but we spend 5 hours with that client. And it's really impactful that we have a good personality and can show them that smile and bring happiness to their face, as well as vice versa. They bring happiness to us because we know that we're taking care of them the best that we can. So I know nursing usually is a pretty underappreciated field. Not a lot of people understand what hard work goes into nursing. So these are just a few clips of me on a regular basis doing what I do, like in class, in the lab, learning new things, practicing new things, progressing my scope of practice, just doing things to make sure that I'm at the best of my best when I meet a new client, when I'm getting out there in the workforce. I know to move on to my RN will be a big step for me. It will be something that I would really want to do. And these are just a few of the things that I do on a normal basis during clinicals and during lab time, just to show my affinity for nursing. You know, we have procedures that we have to do, like NG tubes and catheterizations, and also just talking and caring for our clients on a regular basis. We practice here on mannequins. We do a lot of book work, a lot of projects, a lot of stuff that helps us understand the nursing process and become better nurses. I know for me, nursing has always been a passion of mine. It's always been something that I want to dive into because I really genuinely care about people, and